this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be going over how to work on hip problems. Now, most people, when you ask them where their hips are, they'll say right here, which is actually the sacroiliac joints, the big pelvic bones. But, as you can see from our model here, bones, this is not one of the patients who didn't make it out of here because of decompression. But you can see the pelvic bones here has a socket right here that the leg, femur comes up in, attaches right in here in the ball socket. That's actually the hip joint right here. So we're going to be doing some work on her today to specifically address that. She's had a problem with her right knee, and her right leg is short by ½ an inch, and now it gets even, so that's a positive nocklus. So our pelvis raised up in the air, and a positive Deerfield on the right. So we're going to adjust her right sacroiliac joint, her sacrum, straight superior to inferior, and then her left sacroiliac joint. And you can see I'm adjusting this one differently, but this right one is really tweaked out of place. Now she's going to have some very sore muscles right here. And by the way, these are the muscles that supply the pelvic bones and the hip joint itself, the gluteus medius, maximus, and most important, way down in here is the piriformis. The piriformis is the one that actually comes from the hip joint itself to attach it to the middle triangular shaped bone called the sacrum. So we're going to dig in there and get rid of the trigger points that she has. We're going to do transverse friction on what a lot of people call the IT band. In actuality, it's the tensor fasciolata muscle that goes from the pelvis here all the way down to the knee. And I bet that's sore, isn't it, Lori?
Yes, sir.
Yeah, it is. But this is absolutely, bar none, the best way to help these trigger points and myofascial pain in this IT band or tensor fasciolata muscle. And then we're going to come back down here now and recheck her leg length, and it's exactly even. And I bet you this feels easier, doesn't it?
Oh, yeah.
And it stays even. Now, we're going to do some pretty deep tissue work right here with this Genie Rub vibrator, but I don't just use it as a rubby feel good. I actually get deep down into those tissues so that we can bring blood and oxygen into the muscle cells, but more importantly, allow the muscles to relax enough to where the body can excrete the metabolic waste products of normal cellular metabolism. Now see, that's real sore right there, huh, Lori?
Yes, sir.
Yep, she's got a lot of sore spots in and around that hip joint and her hamstring all the way down into her calves. You notice we don't do things unilaterally, we do them bilaterally, meaning both sides. Because if you don't do things symmetrically, the body will just go right back out of place. She's exactly even now, and that lined up really good. Now y'all are going to like this part on Lori because she moves really good in these. Perfect. That's her lower thoracics, the mid-thoracics, and then now here in the upper back is the upper thoracics, and we've gotten rid of her dowager's hump up here by doing these specific adjustments to line up T1, T2, and the relationship of the head to the upper thoracic spine, which is, before it was forward head posture, and now it's back in its normal biomechanics over the shoulders, but those are still some pretty tight trigger points right there. Now, let's have you turn on your back for me again, Lori. Okay. Now, I usually do the actual hip adjustment right here by rotating. Now you can see I'm rotating all the way up into that hip. There we go, and pull it out. Now it kind of looks like the knee adjustment, but it goes higher up, and again, we get in here and work on these tensor fasciolateral muscles. That's on her left side. And then where she had the knee problems here on the right side, that's real tender right there still, isn't it? The sartorius, which is the longest muscle in our body, goes right from the anterior superior iliac spine down to the medial aspect of her knee. You can get right in the middle of it and do Golgi tendon apparatus and muscle spindle work so that we can retrain that muscle to be its correct length and strength to hold her pelvis and her knee in its place. Those are really sore too. Which side is the most sore? Both. Both of them? Yeah. See, that's bilateral. Both. Very good. Now, you also notice that we checked the anterior aspect of her pelvis here too, and you can tell that that's off today too. So I'm adjusting the anterior superior iliac spine from the front, and now the right anterior superior iliac spine right there. One more. That's it. Excellent. Now our pelvis is level, and that should feel a lot better. Now I'm going to show you how we work on a patient's sinuses. We have the maxillary sinuses right here, the ethmoid sinuses here, and then the frontal sinuses here. I'm going to do this kind of lightly on there. This is very painful treatment. Take a breath through your nose. And put some deep pressure right under the zygomatic process. And follow that all the way around. That's tender, wasn't it? Right one more so? Right there. Yep. Very good. We don't want to do that too hard because Lori bruises easily. Last time I did this on her, she went out here looking like she had black eyes. Now breathe in. There we go. Another breath in. These are the ethmoid sinuses, and I'm applying a very steady, deep pressure superiorly on those. And now I'm going to have her inhale again as I do the superior frontal sinuses, which these are where a lot of people get their sinus headaches right here. There we go. And a lot of times I'll even follow the temporal suture all the way around. You'll feel knots. All three. Feel that one right there?
Oh, yeah.
Yep. She's got a knot on her temporal suture, which you can follow that all the way down to the mastoid process, which is right behind the ear. So again, you just follow that temporal suture all the way around. You can feel it. It's a little groove. And then get those knots out of there. Very good. Okay, now let's turn you up sideways and face towards her knee there. And notice that she knows how to get up correctly from the side position. And now we're going to check her shoulders. There we go. I'm sure you heard that one all the way over there too. That was a good one. There, that one's in place already. If they don't move or pop with a cracking noise, that usually means it doesn't need to move, and we do not force those kind of maneuvers because they don't need to be. So now we're going to adjust her right elbow. She works on the computer a lot, so she sits a lot. Sitting is absolutely the worst thing for the spine these days. It used to be lifting and bending injuries. There we go. Good. Okay, let's come back over here in front of the mirror. But now they found that sitting is actually the worst thing for the spine. Now we're going to take our high velocity, low amplitude Atlas adjusting instrument, and we're going to have to do our posture again, forward and then backwards. Now that's already better range of motion. See, she didn't even have that dowager's hump anymore. Very good. Let's pull these up and back again though. Head straight back this way. We're going to translate you this way. There and right there, C2, and that always give her goosebumps. That's how we know that works, because it's affecting the sympathetic or autonomic nervous system. Okay, let's try that one more time. Look at that range of motion, and that's perfect. Her shoulders are level now, her head's up and back, chin's up. How's that feel?
Feels good.
Very good. How's your hip feel?
Wonderful.
Good, good.
Feels a lot better.
Yeah. Lori's been coming in here for maintenance care now. She's gotten over her corrective care program, and now she's coming on maintenance, and she just stays well as opposed to having to deal with crisis situations on an ongoing basis. This is your Houston chiropractor. We'll see you next time.